Kaiser behavioral health medical necessity runs on one benchmark, the ASAM criteria. And treating a Kaiser member out of network without prior authorization can leave your claim unpaid. Kaiser uses the ASAM criteria to define medical necessity across every level of substance use care. Kaiser Permanente is both insurer and provider. Here is how its medical necessity criteria and authorization process work for behavioral health operators. We cover the ASAM benchmark, how Kaiser's authorization process actually works, and the billing codes you use when external billing is needed. Kaiser Permanente both insures members and treats them in its own hospitals and clinics, so its utilization management is typically internal. Members may get detox at a Kaiser hospital and intensive outpatient at a Kaiser clinic. Care and coverage live in the same system. Kaiser's mental health and addiction medicine services adopted the ASAM criteria for level of care determination across all SUD services. For a non-Kaiser facility, the rule is firm. You must coordinate with Kaiser Utilization Management for authorization before treating a Kaiser member out of network. Kaiser keeps treatment in-network when it can. Out-of-network services require prior authorization from Kaiser's Utilization Management Department. When a denial occurs, it is often a clerical issue, an extension auth not logged, or a claim whose dates or level do not match the authorization. A strong revenue cycle management system helps track these requirements. Behave Health is designed to support the authorization and concurrent review tracking Kaiser work demands. The platform is designed to capture the authorization number, approved dates, and level of care, so the claim you submit matches what Kaiser approved. Behave Health connects documentation to billing, so the ASAM-based justification a payer expects is captured as the work happens. Kaiser applies ASAM across 4 broad service areas. Let us walk through what medical necessity looks like at each one. Detox, residential rehabilitation, intensive outpatient and partial hospitalization, and medication-assisted treatment. Level 1, withdrawal management. Kaiser uses ASAM to decide between inpatient hospital detox, non-hospital residential detox, and ambulatory detox based on withdrawal severity. A non-Kaiser facility providing authorized detox to a Kaiser member typically bills with the standard inpatient detox codes H0010 or H0011. Level 2, residential rehabilitation. Medical necessity requires functional impairments and relapse risks warranting 24-hour care that cannot be managed at a lower level. Kaiser typically approves a shorter initial stay, often around 14 days, followed by concurrent review and early discharge planning. Level 3, intensive outpatient and partial hospitalization. Kaiser runs many of its own intensive outpatient programs. In-network, the care team enrolls members directly without a formal auth number. An external provider billing Kaiser for intensive outpatient uses H0015, with the authorization confirmed in writing first. Level 4, medication-assisted treatment. Kaiser is strongly supportive of MAT and does not require members to try abstinence-based treatment first. Kaiser noted that opioid use disorder methadone, billed as H0020, does not require prior authorization for contracted providers. When you bill Kaiser as an external provider, treat it like an insurer. These are the codes the post maps to each level of care. Authorized detox bills H0010 or H0011. Contracted residential bills H0018 or H0019, often under a per diem agreement. Intensive outpatient bills H0015, contracted methadone dosing bills H0020, and an authorized Vivitrol injection bills J2315. Partial hospitalization care bills S0201, again with the authorization secured in writing before services begin. How you handle authorization depends entirely on whether you are inside Kaiser's network or outside it. Kaiser providers follow clinical guidelines and internal utilization management monitors the case. There is no traditional authorization number. Outside providers contact Kaiser Utilization Management, justify why the service is not available in-network, and may sign a letter of agreement on rates. Kaiser is integrated and outcomes-oriented, so collaboration is what keeps authorizations flowing and claims paid. Maintain contact with the Kaiser case manager and provide timely progress updates. Kaiser sees engaged providers as partners. Kaiser emphasizes discharge planning from day one and steps members down into its own outpatient and MAT services. Kaiser shares the specific ASAM criteria it applies to a case on request, which helps you frame discussions and appeals. Behave Health connects clinical documentation to revenue cycle management, so the elements Kaiser expects are captured as the work happens. The platform is designed to track authorization numbers, approve dates, and concurrent review deadlines, so extensions are requested on time. Designed to align the codes and claim details with the authorization on file, reducing the clerical mismatches that trigger Kaiser denials. Documentation that supports thorough discharge summaries, which Kaiser uses to coordinate aftercare and justify the care provided. Stop losing Kaiser claims to missing or mismatched authorizations. Book a 20-minute demo at behavehealth.com. See authorization tracking and behavioral health billing built for payer work like Kaiser at behavehealth.com.